So a well-functioning nose and sinuses, like that's the gold standard. Like that's that 2020 standard. Like this is what we want. What does that mean? What does that mean? Like in all the years of training as a nose doctor, they must have pounded this thing in your head about what this is how things are supposed to be, right?
Wrong. Yeah, I think that it's breathing can be a very subjective experience. It's either it's a you do or you don't, and if you don't, you know you don't.
Yeah.
Right? If you can't breathe through your nose at all, like you're not moving in the air, then it's like, okay, if I'm breathing through my nose, what does that mean or feel like to me? What is my quality of life like when I'm breathing through my nose? As you know, every study that looks at like actual volume of airflow through a nose and increasing or decreasing doesn't necessarily correlate with how a patient feels like they're breathing.
No.
You know, there's no good correlation there. And so what does that mean for a patient? You know, what's our endpoint? What are we looking for when we're trying to get a patient better or
yeah. Which is, I mean, to me, in my mind, it's getting them. Even I don't have a good answer for this. I've been doing this a long time. I don't have a good answer for like what does that mean. To me, it's optimally breathing through your nose. The challenge is there are times where we will talk with patients. More often than not, we'll talk with patients about procedural options, or when we talk with patients about procedural options, we'll talk about office-based approaches versus surgical approaches. The reality is traditional surgery gets things as open as we can possibly be, but you pay the price of that as far as a more intense recovery. Office-based, like, you know, pretty well, we basically, almost every patient we take through an office-based procedure is not technically as open as true surgery. But I would venture to bet that they're, you know, just as happy, if not more happy than, you know, that more open. And here, my, you know, sort of like how I've come to reconcile this in my head is the most crucial change that we can make for somebody is taking them from compromise, taking them from a nose and sinus areas that are too tight or they're shut down, and you take them from too tight or shut down and you make that open. That's a big change. That's the monumental, that's the earth-shattering epiphany kind of a change. Taking somebody from open to more open is sort of like, that's fine. And so that's where I think the sweet spot from our office-based approach comes is you're taking somebody who is compromised, who's really tight, and you're making that crucial first step in a forward direction. And the other deal with the nose is millimeters matter, sub-millimeters matter, meaning you get an exponential impact for openness. Yes. So when we're talking, like typical sinus openings, most folks are walking around in the world with sinus openings that are a millimeter, maybe less, maybe a little bit more than that, but never as open as we can get things surgically, but they're doing okay. Now you take that same person, you take them and you shut them down, or you give them a little bit of inflammation, then their nose and their sinuses are shouting at them that something's not right here. And, you know, for us to take that and open it up, it's the world. It's a world of difference to those individuals. And so back to that concept, it's really just trying to understand what's going on and then, you know, using the tools that we have to get somebody where they can be.
Yeah, I feel like we have kind of two major groups of patients here. The ones, like you said, that always breathe through their mouths and know their noses don't work, right? Then there's the groups of patients that have nose problems, obstruction, pressure, or facial pressure, that their noses, they think function okay, but they think about it a lot, or they struggle with it a lot.
Right, sure.
You know, and so for me, a win for patients, for the group that their noses are kind of open, for them not to think about their breathing anymore is a win.
Yeah,
right?
absolutely.
Like they come in and they're like, this isn't occupying time in my day anymore.
Yep.
My nose is just working.
Right.
Great. And they're very happy. You know, and then the patients who are completely shut down that breathe are like
right.
I can hold my mouth closed,
right.
and I can breathe through my nose,
yeah.
and this is great. And what have I been doing for the last 25 years of my
sure.
life? You know,
yep.
and so, and that's a big amount of all of our patients. You know, there's some outliers on either end of other issues and things, but
yeah, absolutely. Yeah, and I think the other part of that, and back to what I was saying, is that the folks that tend to be most annoyed with their noses and sinuses, you know, look, if somebody whose nose or sinus areas are completely shut down, but constantly shut down, they kind of can sort of get in this rhythm of like acceptance and like, oh, okay, this is how it is. It sucks, but I'm just going to roll with it here. The guy or gal who is stuck with this chitter chatter in their nose and sinuses of just, it's a little open, now it's shut, now it's open, now it's shut. those are the folks that are, doing anything possible to get that little space, whether it's steam or Flonase or saline or, whatever. They'll scour the ends of the earth to try to get things more open because it's that chatter in their heads, literally in their heads. It's frustrating and it's annoying because I think for those individuals, they go from, like if you get that little, if it's open enough where you can breathe with your mouth shut, things are functioning, sinuses are draining properly, like if you're lacking that, it's heaven. And then you take that away and it's hell. And you bounce between heaven and hell and heaven and hell, and then you're like, it's all consuming after a while because your brain is focused here because it's the start of your airway. So back to like, why does your brain care about your nose? Because it wants to breathe, because it wants to keep you alive, kind of a thing. And those folks tend to be the most frustrated and annoyed. I'd say the most frustrated, annoyed people I've ever seen are the folks who, say, had a normal nose and sinuses. I'd say that the folks that were like really not okay with going from good to bad is somebody who breaks their nose. Like say your nose was fine, you broke your nose, it heals up, and now it's jammed up. Those people are like itching to get back to where they came from because they don't want to be in the hell that it is when you can't breathe through your nose.
But even those patients that broke their nose, do they have to go get big surgery necessarily?
No, absolutely not.
Right.
Yeah, and that's it. And I think and some of them, I think this is the challenge, is some folks will break their nose, be compromised, figure, geez, I was breathing fine, broke my nose, I can't breathe now properly, but the only way to unwind the situation is go through some massive surgery, and that's not the only way. There's typically multiple ways of trying to get somebody back up and running.
Right.
It's just identifying the concept that it's really impactful both ways. It's massively impactful when somebody's nose and sinuses aren't working, and that's an ongoing, never-ending frustration that can be all-consuming. And then on the flip side, it's massively impactful when we take somebody out of that hell and get them back to, get them out of there.
And that's why what we do is it's a quality of life issue.
Yeah, absolutely. But it's fundamental to life.
Yes.
It's a quality of life issue. Period. End of sentence. Next sentence is you cannot live if you cannot breathe. Okay. Period. Next sentence is how do you start breathing? You breathe through your nose. That's how you're supposed to start breathing. And so those sentences create a paragraph that says, yeah, it's quality of life. It's not going to do you in. All true. But on the flip side is it's going to ruin your life if it's not working properly. It will take your life over if it's not working. And there's no reason for that. So I guess bottom line, I think, like I said, we've gone, between the two of us, we spent decades focusing on how to get noses working, sinuses working properly. Yet between the two of us, neither one of us has a good answer on what's the absolute definition of optimized. And all I would say is I know what suboptimal looks like, and that's something we are unwilling to accept and want to do something about.